Good morning, my name is Yasmin and today I will be discussing the expanding roles in paramedicine. During the video I will be explaining the new roles, the need for them, the new scopes, training, medication and skills that have become available in an out-of-hospital environment. To begin, the roles have started to expand in paramedics due to the new access of scope and skill that have become available in a pre-hospital environment. Due to the different levels of acuity care that is now available for paramedics to expand into the different roles and fields to increase their skills and clinical knowledge. Each of the paramedics in this field in the new roles collaborate and work together to provide the patient with the best possible pre-hospital care. The new skills, scopes and medication are taught through master's degrees and a collection of knowledge learned through years of training. The paramedics roles that are currently available are the emergency medical dispatcher, or better known as comms to the paramedics in the field. This is the operational team and the call centre for all jobs that are dispatched to paramedics. Comms are the first line of communication of the patient and the base for collecting information for paramedics to prepare for the case. With the use of comms, the paramedics can report back for more updated information, patient identification, scene safety, and the request for backup from other paramedics from further high acuity care or for our other emergency services such as QPS. The operation members are trained in basic cares to be able to walk patients through CPR if needed or for cares specific to the injuries that have occurred, e.g. applying pressure on a wound or what to do with amputee parts. They also provide the patient and family members with reassurance before paramedics can arrive on scene. Patient Transport Officer, PTO. This is a non-emergency transport system for patients, for inter-hospital transfers or back to home. This service has become available to make ACP crews able to get to more emergency jobs and higher acuity, but still provide a safe transport home for patients in the community. With the service of these paramedics, patients can use resources in an out-of-hospital setting and be transferred safely and returned to hospital care if needed, for going to scans or other medical testing. An Advanced Care Paramedic, ACP. This is a health professional that is the first line out-of-hospital care, medical retrieval, and health-related transport for sick and injured people in an emergency setting. The skills and scopes of the paramedic gives the ability to stabilize critical patients and transport to hospital for further care. The range and ability and equipment carried by these paramedics is crucial in a life-saving capability. ACP go through 3 years of university training to gain the knowledge and clinical skills that are used in the field. With the use of the skills, they are able to make clinical decisions based off the information received from comms and on scene to safely evaluate the patient, and provide the care recommended from the training they have received. Critical Care Paramedics, CCP. This is a health professional who provides high-quality, frontline, out-of-hospital care in the treatment and management of patients in acute, life-threatening emergencies. Critical care paramedics are achieved by completing a master's degree, post-graduation, and a certain level of on-road work. The CCP is required to make rapid, often complex, and critical clinical judgment without direct supervision. Individuals are responsible for their own continual professional development, which may be supplemented by employee-provided training. They provide rapid, specialist clinical assessment by implementing a targeted management plan for patients with significant alterations or challenging to normal homeostatic function. Whilst the role is tasked with providing clinical oversight during the management of these cases, all patient care is undertaken in collaborative context with other paramedic staff or healthcare professionals in attendance. Low Acute Response Unit, LARU. These are a new program that have been put into place to treat non-urgent cases and optimize the use of ambulances to best serve the community. These paramedics are able to refer patients to treatments by GP or other healthcare systems before taking them to the emergency department, if needed. LARU are able to treat types of conditions of low acuity patients are varied and include chronic illnesses needing medical assessment, minor medical problems, superficial burns, lacerations, and minor skeletal or fall-related injuries. This is a new university master's degree to help reduce the level of patients taken to emergency rooms and freeing up higher services for higher acuity jobs, providing the care the patient requires. The paramedics work by themselves and can request backup if transport is required or the job is of higher acuity. High acuity response units, HARU, are staffed by critical care paramedics using techniques and therapies pioneered by battlefield paramedics. These are the new expansion roles are available to paramedics. They are provided an advanced intervention overhand and above standard critical care paramedics in their scope of practice. An example of techniques used by HARU include being able to administer general anesthesia before a patient reaches hospital and to conduct surgical procedures on chest cavities to relieve the buildup of blood or air under pressure. The paramedics are also trained to use ultrasound to identify critical internal bleeding, and this information can be quickly relayed back to doctors at the hospital to enable them to be better prepared when the patient arrives. Flight paramedics are responsible for working to recover or stabilize patients while in transport to the qualified medical facility. This requires providing emergency medical care for those with severe injury, trauma, or illness. Flight paramedics are able to work in extremely high-stress environments. They are on the front lines working in aeromedical emergencies, transport, and evacuation missions. This job combines the skills of critical care professionals with the difficulty of mobile air rescue. These paramedics work closely with rural paramedics all over Australia to help with extrication, as some rural areas are 6 hours away from a trauma centre. The expanding scope of practice and level of skills that are becoming available in an out-of-hospital environment is the reason the new roles are coming into play with paramedic field. Each paramedic contributes to the outcome, no matter what the level of clinical level is, appropriating task allocation and working in parallel optimists with patient care and scene time. The paramedics attempt to think 5 to 10 minutes ahead to plan interventions proactively and not reactively. ACP have a range of drugs on hand to be able to deal with different cases that they attend, with pain relief, medical treatment, options, and safety precautions of sedation being able to be used. These can be used to stabilize people prior to further hospital treatment. These conditions can include medical such as cardiac or respiratory health problems or trauma related with blood loss or need to tourniquets and pain relief. The CCP have access to advanced airway, pain relief, and other equipment that have been trained in and skilled to use. This adds another level of care for the patient. That are able to back up paramedics at critical scenes. This helps to further stabilize critical patients, and the extra hands and scope make it easier for paramedics to do further assessments on field and treatments for better patients. Who have begun to access in skills that doctors and ED have training for. This gives them access to medication, blood infusions, airway training, and skills that are crucial in life-threatening situations in rural remote areas, or difficult situations that are hard to extricate. One of the skills that have become available in the field is RSI, which is a rapid sequence intubation. This helps stabilize patients on long transfer times and is safer in a critical condition such as traumatic head injuries. With the access to further training and the new roles that can become, it is creating a bigger field to work in and a safe environment. As Australia has many rural areas and long transport times, this will help greater care patients in the field and with more resources available to be accessed. Due to these expanding roles in paramedicine, this is now able to stay and play in the field, stabilizing a patient more securely, and reducing the speed in which you must transport a patient to the hospital destination. This is making it safer for crews and the patient, as the golden hour has expanded dramatically due to the different equipment and medications that can be used to treat the various different causes and injuries that are laid upon the QES field of work. In conclusion, the new range of medication, skills, and equipment that is now available to use safely in the pre-hospital environment is now making it become easier for high acuity care and to give a high level of out-of-field work. With Australia being a vast country, and with various different rural areas, it is becoming important to further our clinical knowledge and continue to grow, expanding our clinical fields and our roles in paramedics.